Welcome to Insights. I'm Dick Goldberg, and our subject today, suicide in America. How often does it happen? Why do people do it? What are the trends in this tragedy? And what should we all know to help anyone in our path who expresses suicidal thoughts? With me today is Karen Stevenson. Karen, a master's in social work and been in this line for a long time. She did 30 years of work in emergency mental health of a community mental health center in Madison, Wisconsin. And for her last 19 years, she was manager of that unit. Presently, she is volunteering, as she's retired from that career, in a survival group, i.e. people who have experienced others who have had suicide, and it's a support group for
yes,
that. Have I got that right, Karen?
We would say survivor rather than survival.
Oh.
Yeah, survivor group.
Well, thanks very much for being with us. Can you give us any idea how many people a year in America commit suicide?
Yeah. In 2010, which is the last year that we have complete numbers for, it was actually 38,500 people.
Oh my gosh.
One every 13.7 minutes.
Oh my
so
gosh.
in the course of our half-hour podcast, theoretically there could be 2 suicides.
Oh my goodness. 38,000.
38,000.
How does that compare to other things? Do you have any idea, like traffic deaths or?
Well, just fairly recently, it was reported that suicide had overtaken traffic deaths as a cause of death. And the thinking on that is that for at least 25 years, there's been a real concerted effort to reduce traffic deaths, through seat belts and better equipment and law enforcement, public education, I'm not sure what, but that rate has gone down, and so suicide has actually gone up slightly during that same time period and has surpassed it as a cause of death.
Wow. But it's not viewed as an urgent national issue the way traffic is and traffic deaths.
That's true. That's
Okay.
true. It may be because we don't talk about suicide all that much. It's a difficult subject to talk about, and so I don't think it gets near the airtime or journalistic time that.
Oh, good. I'm glad we're talking about it.
So I am glad we're talking about it.
Who is this group? Is it young, old? Is it ethnically black, white, Asian? Who does it?
Okay, we've got varying statistics on that, and I'll just give you some of them.
Sure.
Because some groups compare groups that aren't exactly comparable, and so they're
Sure.
not exact. But in 2010, again, the highest rate of suicide was the age group 45 to 64.
That's surprising.
Now, prior to this, I was surprised by that too, but probably different reasons from you. I expected it to be the over 65 age group, because that's traditionally been the very highest suicide rate.
Why?
We get more, I think we get more publicity about youth suicide, but in reality, elderly people are far more disproportionately at
Okay,
risk.
I would expect that's because they have illnesses and they don't want to live with their illness. Is that the reason?
And losses, and progressively, alone. So that the very highest suicide rate is among white men over 85.
That is the highest.
That is the highest. Yep.
Why not white women over 85?
Well, as I'll explain a little bit later, throughout all the age groups, women complete suicide at a much lower rate than men do. They attempt suicide a lot more often. The overall number, the overall estimate is that they make 3 attempts for every completed suicide. And whereas, I think I just...
Yeah, I know those. I've seen these statistics. Something like women do an awful lot more attempts than
far
men.
more attempts. Men complete far more often. Overall, men complete suicide 4 times as often as women.
Once they start,
Once they do
they're
it,
4 times
yes.
more likely to succeed.
Among the very elderly, 84% of elderly suicides are men and only 16% women. So women's rate actually goes down as they get older.
Hmm.
But among all the age groups, the completed suicides are far more by males.
What I've heard is that men use guns, and that's going to be lethal.
Yeah.
Women use like pills, or what do they do?
Yes, I think that is certainly the conventional wisdom. That it's changing. Women are using more firearms now than they used to.
Oh.
For instance, in 2007, the breakdown on methods was that firearms were used in 43% of the suicides. Now, when you break it down by gender, 56% of male suicides were gunshots, and only 30 were women.
Why do you think that? Why do you think that is that women don't use guns and men do?
I don't know that I have a good answer. Just men are probably more men are brought up with a comfort level with guns and with violence. But as I say, the numbers for women are creeping up. And in 2010, the overall firearm rate, I don't have a gender breakdown, was 50.6. So when you make an attempt with a gun, you're much more likely to end up dead.
What is the 50.6?
50.6 is the 2010 numbers.
Of what?
I should have explained that. 50.6 out of 100,000 deaths were from gunshots.
I see. So suicides completed, half of them about it were from
roughly
gunshots.
Half
when women attempt suicide but don't succeed, fortunately, are they calling out for help, or as men just know they're going to do it?
I think that would be an easy assumption. That may be part of it. That's undoubtedly part of it. But I think anybody who makes a suicide attempt is seriously in distress. I don't think anybody does it. That traditional cry for help can easily be kind of minimized in importance, but I think every single attempt should be taken very seriously. The fact that women are more comfortable using medication, it doesn't make the intent any different. It just makes the result different.
This might be a little premature in what we're talking about, but you mentioned old men do this because of the losses at 85, and you mentioned their loneliness. Do you see loneliness, feeling isolated, as related to suicide?
I think particularly in this sense, when we talk about the risk factors for suicide, there are several of them, which I'll get to in a minute. If you add to that a situational factor like a loss, an important loss, through divorce or death, or financial loss of a big nature, loss of self-esteem.
Could be a job.
Yeah. The individual situation is something many people experience and don't become suicidal over. But when you couple that with a risk factor, say, of chronic low-grade depression, then you're more likely to get suicide risk. So no one of these factors in and of itself, is a definite predictor of suicide, fortunately. Most people don't commit suicide.
But a lot do.
But a surprising lot.
What percentage, I don't know if you know this number, but how many of them are schizophrenic? I mean, they really are delusional or whatever, versus they're more depressed or troubled?
I would say far and away, the estimates are that 2/3 of the completed suicides are suffering from either depression or bipolar disorder, which is a kind of a combination of depression and, for many people, alternating with periods of mania.
Right. And those depressions, I have a hunch, are deeper than the person who's just depressed. When they go down, they really go down.
In many cases, they are. So depression is far and away the biggest mental health diagnosis associated with suicide. Now, I cannot tell you how many of the suicides are from people with schizophrenia, but their suicide rate is definitely higher. That is a definite risk factor.
Mm-hmm.
There's no question about it. Other mental health diagnoses as well, such as borderline personality disorder, has a significantly higher rate of suicide than certain others.
So the more severe your mental issues, the more likely you are to
Yep.
suicide.
And I want to add, in addition to mental health issues, alcohol abuse and drug abuse needs to be included in that. Those are diagnoses as well. And they're often in combination with one of the strictly mental health diagnoses.
Okay. So if you were to draw the profile of a person who's most at risk for suicide, what would that look like?
I would say a person who is suffering from depression, and I want to point out that these numbers about depression are sometimes gathered, or often gathered, from studies of people after the suicide has occurred. It's not going to appear on a death certificate, and police don't keep track of how many people are depressed. It's looking at massive numbers, studying them, looking back over the lives, interviewing people. They call these psychological autopsies.
Yeah.
So they draw some conclusions from those.
And are these things people didn't see when they were alive, and they realized, oh my God, I wish we had known?
I think there are definitely some of those. Some of those. I talk in our survivors group that you mentioned. Every single meeting, there will be some people that were blindsided by the suicide of a loved one. They had no idea.
How can a person keep that secret, that they were so upset and depressed?
Well, some people are very private and very good at keeping it a secret. Wow. I think there's also a group of people who take their lives who really do it impulsively. We don't talk too much about this, but I certainly believe it to be the case. And I know in our service we saw people who had not planned out their suicide. When you are talking to somebody about suicide, you want to get a risk or a history of impulsive decisions. People who have a habit of acting before they think about something, and that's where a ready availability of a weapon in the house can make a difference.
Wow. Do you think many or most suicides, if they were prevented at the moment the person had the impulse, that urge would never come back? Or does it tend to be a recurring thing in people's lives who do wind up killing themselves, that they tried and they tried?
Well, like all these questions, there's not a simple answer to that. The best predictor, statistically, of a suicide is a past suicide attempt. So there's definitely an association with making an attempt. It probably just lowers a bar, lowers a comfort level with thinking about suicide as a possibility. So there's that fact, which would indicate...
So once you think about it, the next time you tend to find it easier to think about.
Yeah. On the other hand, I would never make the statement that once you've made an attempt, you're probably going to kill yourself. That is not true.
Yeah.
We're talking a great deal of variety and different types of dynamics and different types of people, but that it is definitely a statistical fact that a suicide attempt in the past is a good predictor, which would mean the answer to your question is that the person just doesn't get it out of their system and it doesn't come back again.
Wow. So it's not just you happen to hit a low moment in your life and you'll never be that low again.
There might be, I'm sure there are those people, but more of the other type.
So you were running a hotline and an emergency service for 19 years. Do hotlines or suicide lines call this number if you're thinking of suicide? Do they prevent suicides?
That I'm glad to have a chance to try to answer that question. My belief is that they do, for this reason. And I went back and talked to a couple of my colleagues and found out that they still agreed with me on this. There are those people who commit suicide without ever having spoken to anyone about it, as far as we can tell, as far as anybody can tell. They just go ahead and do it. Far more people are very ambivalent about this decision. They're mixed up, they're distressed, they may be drinking. they may be very frightened by the thoughts that they're having about suicide. And so when they either get up the courage to call a line themselves, or the other major way it happens is that a friend or relative calls on their behalf about them. You already have an opportunity to engage this person somehow, to get in there and get involved. And I think what a hotline does is, first of all, makes a connection with the person. You are not alone. You are not, people feel that they're totally alienated. They feel they're crazy. No one else has felt this way before. They're defective. There aren't very many people to whom you can talk about your suicide feelings without the listener, getting scared, perhaps overreacting, leaving, whatever. People aren't too comfortable with this subject. So if you can find a place to talk to, yes, you called the right place. I'm very glad you called. I'm here to listen to what's going on for you right now. That first step is, I think, a very important step in suicide prevention. Then what you're really doing is listening. You're not jumping in with solutions. You're listening, you're corroborating that the person really is in trouble. Mm-hmm. They're facing a difficult situation, whatever it may be. They feel bad. Mm-hmm. You're not talking them out of it. You're corroborating that. And yet, despite that, you as the person on the phone with them believes that you could help them. You really believe that there are some resources out there, some sources of help. It'll take a little time. We need to work with you on this. And a lot of suicide prevention is buying time, so that the acute phase of a crisis begins to subside a little bit.
Are you selling hope?
I think so, and not in an ideological way,
no.
Certainly, but I think, yes, I would say that's a true statement. Mm-hmm. Because the person who's feeling suicidal, and it's a risky, the most, I failed to mention this when we talked about the highest risk person, the person who feels both helpless and hopeless. Helpless, there's nothing I can do. There is nothing I can do to change my situation. Hopeless, nothing else is going to change the situation either. So I am trapped in this set of feelings that I have. Now you can imagine, if you truly believe that, that's a very bad way to feel.
Yes.
So the person on the hotline is saying, now wait a minute. I think there are sources of help. Let's talk some more. I think there are ways to intervene here. And one of the things you're doing that is so helpful to people is you're starting out with like an overwhelming mass of problems, fears, anxieties, worries, if this, then that, that the person can't even begin to figure out. And you're helping to maybe organize that a little bit into some small units. What's the most important first step? What's something you do have a little control over? What's a phone call you do need to make to start this ball rolling? A simple first step becomes the beginning of a plan.
Yeah.
And I'd have to say...
So that takes care of some of that helplessness, if you have some idea of something you can do.
I would say so.
How much of this is breaking that isolation and loneliness, being heard?
I think it's a big part. Being able to talk about your suicidal feelings and what a jerk you feel like, maybe, or how angry and hurt you are by something, no matter what it is. Being able to talk to somebody who will listen respectfully, not jump in with answers, but I think that's very powerful in helping people.
Is it worse on the holidays? You get a lot more business and Christmas.
That is so interesting. You would certainly think so, and yet it is absolutely not true.
Wow.
Yeah, the suicide rate is often at its lowest, for instance, in December.
Huh.
Yeah, and it's at its highest year after year after year in April, the beginning of spring.
Any ideas why?
It's just speculation, but it would be maybe the expectation of spring and I should feel better, or things
Yes.
are coming back to life.
Yeah.
I don't know. That's just hypothesis.
You know, it's really important. People listening, what do they do if they think someone in their circle might be thinking suicidal thoughts?
Mm-hmm.
They're not a professional.
Yes.
They haven't said, help me, but they've heard things from their child, their friend, their spouse, that I don't think life's worth living.
Mm-hmm.
Or hints that scare them.
Yeah. Well, there are definitely things they should do. There's no question about that. I think they have to get up their courage and open up the topic of suicide with their friend or their loved one. First of all, come right out and say it. Use the words, I'm worried about you. I'm afraid you might be thinking of killing yourself or thinking of committing suicide.
People are afraid to do that, aren't they?
Yeah, I think a lot of people have the mistaken idea that if you bring the subject up, you'll actually plant the idea.
Mm-hmm.
There's no evidence to suggest this, just none whatever. So I think that's one thing people don't have to worry about. Again, to be that person who's not afraid to bring it up, it is a real service to the person.
Yeah, why?
Because not many people do.
Mm-hmm.
People, especially people who tend to keep their feelings and thoughts private. You're not going to talk about this at work. You're not going to, talk about it at a family gathering. Probably, it's going to take someone reaching out to you.
I would think that would be a real relief to the person who's suicidal, to finally be able to tell someone their dark thoughts.
Yeah, I think you're absolutely right.
Because they're scared, right? They're scared.
Mm-hmm.
And as you say, they're scared of the idea of suicide, but they're driven toward it.
Right. And they are ambivalent, as I said.
Yeah.
And again, there are those who who seem to have been very purposeful, just went ahead, planned it, did it. We can't worry so much about them because we don't know enough about them yet. We know there is a huge number of that are ambivalent and that would like help, would like to not do this and don't like the way they feel.
Yeah.
So those are the groups, those are the people we have to address. So getting back to how to help your friend or your family member, once you've brought up the subject, and you mention it right out at the beginning, I'm worried that you're thinking about suicide because of what you said to so-and-so the other day. He repeated it to me. Or I saw you doing this. I saw you, one of the things that people sometimes do when they're thinking about suicide is give things away, give their possessions away.
That's a tell for you.
Yeah, that is definitely a red flag. It's isolating, making statements that I don't know how much more of this I can bear, or sometimes I just think it's not worth it, kind of vague statements like that. Just don't let those pass without
Okay,
inquiring.
so let's say you do inquire and they say, yeah, I've thought about suicide.
Yeah. Okay.
What do you do if they're kind of closed mouth? They're not real open with you.
Yeah.
But it's your partner or your kid. Then what?
I think you just have to, stick with it, struggle with it. You want to ask them if they've thought about what they'll do, because that is a big help in figuring out how urgency there is to this. Is it simply, I've thought I'd rather be dead, but I haven't given any thought to what I would actually do to make that happen? Or you might find out I got the gun out of the cabinet and I have it in
what would you do then?
in my glove compartment. Well, we always, and I think police would do the same thing, if there is a gun and a distressed person thinking about suicide, we want to get the gun away from them. We really, it's the first intervention. If the person will give it to you, that's nice. Would they give it to the police? The police departments at least in our community, but I bet this is true everywhere, would make a real effort to come and take a gun from someone who's suicidal and just keep that gun for safekeeping. Can it be locked somewhere? Can it be given to a neighbor or somebody who lives elsewhere?
So if that's the case, you might gently ask, would you be willing to let me hold it? I'm worried about you. If they say no, then you might consider bringing the police in.
Yep.
Okay, what about getting them some help?
Yes, that's obviously another very important part of it. You want to encourage that they see a mental health professional for an assessment, if nothing else, just to get that mental health person's assessment of how serious a risk this is, and hopefully get them connected with some treatment. Because treatment of depression, for instance, and I said they estimate that 2/3 of suicides are people suffering from depression. Around the world, only about 25 people with depression are actually getting treatment for it. I'm sure it's higher than that in the U.S., but we've got all kinds of numbers from these post-mortem studies that indicate only 30% of the people who committed suicide actually saw a mental health professional in the last year.
What a shame.
So that's not many.
Yeah.
When we know that treatment for depression is actually very effective for lots and lots of people. The estimates are 60 to 80%. So that's a pretty high effectiveness rate. But you've got to get there first, into treatment. So as a friend or family member, I would offer to help with that. Don't just give the advice, go and get some help. You go to the phone book with them. You call your primary care physician and ask for a referral, perhaps, the name of a recommended counselor or psychiatrist. Look for a walk-in clinic, if there is such a thing. That's a great service in a community. If nothing else, a hospital emergency room.
If they'll go.
If they'll go. And if people are, if the person is refusing, you've pulled out all your tools and your concern, your caring, and you feel like you're just getting nowhere. We received many calls in my service from family members at that point. And then we would do outreach on the phone, depending on what we were hearing. If there's a weapon nearby, if it sounds like it could be an imminent emergency, we would always recommend use of the police.
And they'll come to the house and bring them to an emergency room?
Yes.
And then that
leads to a referral to every emergency room is going to have access to some mental health help. Yeah.
So that person might be put in a hospital for a short period to be observed.
They might be hospitalized. Lots of people, surprisingly, do not need to go into a psychiatric unit. What they need is to know that there's help on the way and to have a connection established. I've got an appointment with so-and-so, and not only that, my brother's going to go with me. That's another thing for the friend or family to do. Offer to go with. And in fact, I would recommend people to be a little bit assertive about that. I'd like to go with you. I won't go into the office if you don't want me to. But let me come and pick you up. I'll take you to the appointment. I know it's going to be nerve-wracking for you. You're going to be nervous. I want to be there with you.
Okay, so the one thing I'm hearing is be active. Don't be shy.
Exactly.
Jump in there.
Yep.
Is there anything, as we're running out of time, anything important that you want to bring into this that you think people ought to hear, or have we pretty much covered the basics there?
Let's see.
One thing is prevention. You mentioned you wanted to talk a little about prevention, as we chatted before, of suicide. Anything there you want to bring in?
I think everybody can be a suicide preventer. That's why they're teaching school teachers and ministers and school cafeteria employees and social groups all over. There's a big movement afoot to say some of the things that I've been talking about. Suicide prevention isn't magic. You don't have to have a college degree to do it. You have to care be a little assertive and not be afraid to talk about this topic. I think that has great potential. The other major thing that I think experts are identifying is our primary care doctors are often the ones that see people fairly recently, fairly close to the time of a suicide, and that they need better training in looking for signs of depression. Because we believe that if we can get people with depression into treatment, a lot of them will not go on and commit suicide.
Well, Karen Stevenson, I thank you very much. I think this is very helpful in understanding this tragedy in America.
Thank you for having me.
Here's an epilogue to this podcast. 2 weeks after the interview, the Center for Disease Control and Prevention released new data. Suicide in America increased a great deal. In 1999, there were 29,181 suicides. By 2010, that increased to 38,364, a 31% increase. Surprisingly, all the increase was in the 35 to 64-year-old age group. Ironically, most resources for suicide prevention are geared toward students and seniors. The reason for this increase seems to relate to the economy and rising financial problems and unemployment for this age group. I'm Dick Goldberg, and I hope you'll join us on the next edition of Insights.